Hello everyone, Mr. Shepherd here again with some history and our walk for today. We're going to be looking at the impact of modern medicine of Florence Nightingale and Mary Seacole. Now, Florence Nightingale studied nursing in Germany in 1851. It was here that she learned about the importance of cleanliness in hospitals, which were at that time filthy and unsanitary. So unsanitary just means basically the same as filthy. Everything was very dirty. Florence was a brilliant student and was soon running a women's hospital in London where she drastically improved working conditions and patient care. So she took what she'd learned in Germany and she used that when she was working in the hospital in London, and radically improved the conditions there. When news reached England of thousands of British soldiers who were dying because of lack of proper care and severely infected wounds in the war in Crimea, the British government asked for Florence's help. So she'd got a bit of a reputation now because of the work she was doing in London, how well everything was going. And they then approached her to help with this problem they had in the Crimea, where the soldiers were dying because of how bad the conditions were. Florence agreed and she travelled to the hospital in Scutari, where she found the sick and wounded soldiers in filthy, squalid conditions. So obviously at that time, travelling to the Crimea quite a way away would have been quite a dangerous thing for her to take on, and she would be at risk. Well, she's going to a place where there's a war, and she'd be at risk of disease herself, and all those sorts of things that came with travel especially during those times. So quite a brave thing that she was doing. She took nurses who had volunteered. I think there was about 36 nurses that she took with her to help over there. Infection and disease was spreading quickly and causing the most deaths. So she realised that because of the work that she'd been doing in London and the training she'd had in Germany, she'd sort of realised how important sanitation was and just how much it could improve things in a hospital, and how you can have deaths just from having people in filthy conditions. So she soon realised that the main thing that she could do to help people and to stop the deaths that were happening was to improve the conditions as far as the cleanliness of the hospital. Due to the changes made by Florence, such as improving cleanliness and ensuring fresh meals and clean water, in a short period of time, infection and disease were improved. As a result, there were far less deaths. Quite a simple thing to be able to do as well. So, a lot of hard work, but generally, if you had the people to do it, you can affect fairly big changes by just improving cleanliness, and then you get big results as far as stopping people from dying. All right, so Mary Seacole. Mary Seacole did not have a formal British nursing qualification or training, but she relied on her skill and experience as a healer and a doctoress from Jamaica. Mary learnt about medicine and herbal cures from her mother and developed her caring, nursing and doctoress skills. So she wasn't a nurse in the traditional sense that we would think of in England. She was a traditional healer in Jamaica. So they were mainly using herbal remedies. And she'd had quite a bit of experience with that because her mother had helped people over there with using her doctoring skills. Mary Seacole heard about the plight of the soldiers in the Crimean War and she wanted to help. Her application to work as a nurse in Crimea, however, was refused by the War Office, even though she had excellent referees. We were talking about that last week. In 1855, Mary travelled to the Crimea. She brought medicines and supplies with her and opened her first general store / restaurant and hotel in Balaclava. Here she became known as Mother Seacole, as she immediately began to care for and treat the sick, injured, and battle-weary. So we were talking about how she wasn't in the same situation as Florence in that she didn't have the backing of a government sending her there. She basically went there because she wanted to help out and just paid her own way and set up her own place to heal the soldiers over there. Do we still use the innovations of Mary and Florence that Mary and Florence used? Florence was a gifted statistician. Now, this means that she was good at finding out information like how many people were dying because of unhygienic conditions in Scutari Hospital. She always also came up with clever ways of showing these numbers in pie charts and graphs that made them easy for other people to understand. Some of the graphs she used to show people this information are still in use today. Okay, so that's part of the reason why she was so effective, was she was able to explain to people and show them with her graphs in an easy way. They were able to understand how many people were dying and how many people she could stop from dying because of changes in sanitation. So because of her statistics, she was able to show them how much she'd made an impact, which then made people understand her work better. And then, of course, they were more willing to back what she was doing. Because her work in Crimea was so successful and saved so many lives, she became famous. Okay, the newspapers at the time were writing about Florence Nightingale heading over there and the work that she was doing. The innovations, now when we talk about innovations, we're talking about the positive changes that she made. They led to improvements in conditions in hospitals across the world as they began to take on her new way of doing things. So as people heard about how successful she'd been in the Crimea and saving lives, they wanted the same things for their hospitals, okay? And all across the world, they started to make the changes that Florence had made in the hospitals. At this time, nursing was considered an unpopular, unimportant, low-status job, which had no formal training. So low status means that people didn't really consider it was that good a profession. People didn't want to become a nurse. Nurses weren't very well thought of, and they didn't think it was very important to become a nurse, because nurses really were just doing sort of small tasks that were assigned to them by doctors. They weren't doing the sorts of work that Florence started doing when she went to Crimea. Largely due to Florence's influence, nursing became a well-respected profession. Nurses began to receive proper training, and the way hospitals were run changed forever. So, because of the way Florence changed all the systems over in the Crimea, in the hospital there, she really had much more of a role to play. She didn't have a traditional nursing role as it would have been at that time. She was far more effective in what she could do, and she was making big changes to the way things worked. Okay, as far as improving sanitation and things like that. Along with her commitment to hygiene, so when we're talking about hygiene, again, we're talking about cleanliness and sanitation. They're all sort of similar sorts of words, okay? Florence realised that the design of hospitals themselves affected the health and recovery of patients. She created wards that were large rooms with beds alongside each other that allowed nurses to easily see and tend to patients. This design was particularly effective if there were lots of patients that needed tending to. She also believed in well-ventilated hospitals with lots of fresh air. These innovations are still in use in hospitals today. So just by the design of how things were laid out, nurses could more easily see patients and see who needed help, okay? And that helped them to be more efficient in their work, which then, of course, had an impact on saving lives. So Mary Seacole, herbal remedies were widely used during this period and could be very effective. Some of these herbal remedies are still in medicine today. For example, aloe vera cream is used to treat frostbite and dry skin. Ginger is still used in tea to soothe sore throats and colds and settle nausea, and lemongrass can be used to help soothe a fever. Many medicines today are manufactured synthetically, which means that they're sort of made rather than being natural products, but they're based on ingredients originally derived from plants. Okay, so a lot of our medicines that we've got now, they began as plants and herbs and things like that, and then we've worked out how to create them artificially, create the same sort of chemicals. In Crimea during 1854 to 1855, Mary Seacole demonstrated that her homegrown Jamaican practice of hygiene, healthy food, and natural remedies and kindness had a lot more to offer than traditional medicine, making her nursing practice a far more modern, holistic one than people might have imagined. So at this time, you had some fairly questionable practices going on with people being given mercury and lead and things like that were, and they were doing bleeding at this time, where they bleed people, take some blood out of them because they thought that helped cure them. So she was mainly just helping them by showing them kindness and giving them natural remedies and liquids to drink and things like that help with the sort of conditions that they were suffering from, like cholera. Holistic medicines consider a patient's mind, body, and spirit to improve their health and wellness, and has taken on greater significance in modern times. So now in medicine, we sort of recognise that you've got to care for people's mental health and that sort of thing, as much as you've got to care for their physical well-being. And that's become more prominent in recent times. Wouldn't have been back in the time of Mary Seacole. How have innovations progressed? At the time of Florence and Mary, many people believed in something called miasma theory. It was thought that diseases were caused by bad air. People believed that this air smelt, and so if you got rid of the smell, you could get rid of the disease. Fortunately, Florence believed in getting rid of these smells by making everything really clean. We now know that germs and viruses spread disease, but it turns out that making everything clean helps get rid of germs that cause illness. We also now know that Florence was right. Having clean water and nutritious food helps guard against disease. So even though she believed in this idea of miasma, where it was bad air that was causing people to be sick, the solution that she came up with of making everything clean actually helped improve things, because now we know that germs cause disease, and to fix the situation with germs, a lot of what you do is make everything really hygienic and clean, like we've got in hospitals today. So even though she was coming to the solution from a sort of misguided place, she still came up with the right answer as far as the fact that she made everything clean. It then improved everything for people in the hospitals anyway. Some other remedies used at the time, however, such as sugar of lead and mercury, we now know to be quite toxic and would actually have done more harm than good. So people using things like mercury, which we know is really quite toxic now, and lead, which also is toxic, which affects you over time fairly badly, okay? We don't use things like that today. So they would have actually been more harm than good, but at that time they thought that they were helping people with those sort of remedies. Which innovation is the most important? Florence Nightingale's forward-thinking reforms have influenced the very nature of modern medicine. Her initiatives in sanitation have undoubtedly saved countless lives. Later in her life, Florence helped to convince the government in England that all private houses should be connected to mains plumbing in order to improve sanitation. Many historians now believe that this improvement in sanitation helped to increase how long people lived by 20 years from 1871 to the mid-1930s, during which time medical science made little impact on most fatal disease. So what we're saying there is, after she'd finished her nursing career, she then went on to help with trying to get just the average person more cleanliness in their houses and better plumbing and things like that, that would drain away waste and all that sort of thing that would cause problems with disease and germs and all that sort of thing. So just the fact that she managed to use what she'd learned in her nursing career to help people, just general people in their homes. We're saying here that during from 1871 to the mid-1930s, people actually started living longer, on average 20 years longer, okay? And a lot of people put that down to the fact that the sanitation had improved, because when you have